Okay.
Well, as Tony was nice to give me a little basic introduction. My name is Brian Borg. I live in the Riverside, Norco area. I've been doing equine dentistry probably since about 2000. So it's about 8 years. I think I have about 10,000 horses under my belt as far as horses I've actually done dentistry on. And with that, obviously seen a wide cross-section of problems. Dentistry as we know it, there's a couple different ways. You've got your farrier, or your, what I call kind of like cowboy float, where they get a rasp and they file off some sharp points. And a lot of veterinarians will do something similar. They'll do some basic file floating. My vet actually, we had this conversation. She made a good point. She said, when I went to veterinary school, the first 3 years was really a lot of just studying and not a lot of hands-on with the animals. It was mainly dog and cat. And then they did the fourth year, they did a little bit more, hands-on with the animals and that type of thing. But horse dentistry was not a big issue, because when you're studying to be a vet, you may study to be a vet and decide that small animal is the thing you're going to do. So if small animal is the thing you're going to do, they can't put a huge amount of time into horse dentistry, because you may never see a horse for the whole practice. You might go into cattle and pigs and farming. So they don't know where you're going to go once you're finished vet school. So they cannot focus extensively on any particular animal. They give basic anatomy, and then once a vet becomes a veterinarian, they do an internship and they sort of like develop their skill in whatever it is that they want to specialize in, or what type of animal they want to focus on, whether it be birds or exotics, or whatever they end up deciding. So dentistry is not something that is focused on extensively, and then it's up to the vet once they leave vet school to pursue dentistry themselves and get more education if they so desire. So a lot of times you'll just see, like I said, a basic float. And this isn't to put down the veterinary industry, because I work with vets all the time. I have vets that call me out. We do clinics, dental clinics, where they're quite comfortable with the fact that they're not really keen on the dentistry portion of it, so they just bring me in and we work together as a team. I'm very friendly with vets, so I just want to bring out some basic facts that's just the way the industry happens to be. Now, file floating is, a lot of people don't realize, it's just some basic points that are getting filed off the horse's teeth. As a general rule, they're filing the outside edges, those annoying sharp points. Everyone is familiar with that term. Those points are important to remove because that aggravates the soft tissue inside the horse's mouth. Now, the problem is that you or I do not use the sides of our teeth to masticate and process food. We use our occlusal surface, which is the actual surface here, where it comes together to grind the food down. And in order for a horse to digest properly, they need the food particles to be ground down. Actually, it says 3 millimeters, but obviously all your horse's food is not going to be ground down to 3 millimeters. So it's quite a small particle where they get maximum nutrition out of the food, and it makes it easier for them to digest it. So the occlusal surfaces need to be maintained. So if a file float is being done and the points are being done, they haven't really done the occlusal surface area, so problems can be developing that actually never got addressed. Meaning the horse's teeth could be floated, and then there was a problem in there and it didn't get taken care of, and it progressively gets worse. Even if the horse's teeth are floated every year, just the points only, that occlusal surface will get continually worse. And now I'm going to explain to you why that is.
Wait, what is the occlusal surface?
The occlusal surface is basically the area where the teeth meet to chew. Okay?
Why do horses need dental work when Mustangs out in the wild don't have dentists?
That's a really good question. I'm going to give you a really good answer. First off, wild horses don't live that long. 17, 18, that's good for a Mustang. One of the worst skulls I have here is a Mustang skull. It's a 25-year-old horse, and it was at a rescue, and I'll get into that in a little bit. But let me explain to you the way the mouth works, so that it all starts to make sense when you understand this one important factor. Horses' teeth erupt. Now, what erupting means is they have teeth in their jawbone that are really long. Everyone thinks, you only see about a ½ inch of their tooth above the gum line. So, you think, okay, there's ½ an inch of tooth, maybe the tooth is that long, like we have roots in our teeth. That's the perception. Well, the teeth are long for a reason. Grinding their food is very hard on the teeth. So if they had short little teeth, within no time, they wouldn't have any teeth left. So what nature has done, that's quite a little ingenious thing that nature has provided them, the teeth erupt, meaning they're moving up 1/8 of an inch a year and keep supplying more and more tooth. Okay? So over the lifetime, the suspected lifetime, which is 15, 17 years old of a wild horse, they have enough teeth to last that lifetime. We keep horses a lot longer than that. And by the time they're in their mid-teens, their teeth can be in pretty bad shape. Also, horses in the wild don't use a bit, not being ridden. And there's a lot of, and if some will die very young with a tooth problem. So a horse could have a tooth problem at the age of 5 or 3 for that matter, and be the end of that horse. I actually had a client with a Mustang that had major problems at about 3 years old, and we corrected him. But that would have been, this particular young Mustang had a problem that probably would have killed it in the wild. But we caught it early and we fixed the problem, and it's doing just fine. So the eruption is the important thing to know, and here's why. All these teeth are not going to be the same strength, okay? So when you have opposing teeth, the stronger tooth is going to wear away the opposing tooth, and now the surface becomes unbalanced. Instead of it being relatively level, one tooth will dominate and wear away the opposing tooth. Now I'm going to show you the Mustang skull. I think I have it out. If I don't, I'll go grab it. There it is right here. One of my favorite skulls because it's one of my most dramatic skulls.
Wow. Jeez.
Understand these are all supposed to be the same length.
Wow.
What's happened here to this Mustang is these teeth were stronger than the opposing teeth. So this is what's called a wave complex. Now if you floated, by the way, floating in most cases, they're just filing the points on the upper teeth, the outside edge, filing here, rasping off those sharp points. Beneficial, not a bad thing, but it's not the whole picture. The occlusal surface is supposed to be corrected too. On a regular float, that usually doesn't happen. So if they're floated and it's just the points, these waves, mine just took 25 years to get this bad, will slowly, progressively get worse and worse. What we want to do is look at the occlusal surface and see a minute rise in the teeth. And I use motorized equipment because really it's the only way you can get to them properly. It's a industrial diamond disc. It has a tissue guard. And what I do is I go inside the mouth. I have a Dremel motor attached to me so it rotates everything. And I look at that occlusal surface and start making corrections on any tooth that's higher than it should be. Then I flip it around and do the same on the other side and balance the whole mouth together again. Now once you take any kind of reduction here, you've got to make sure that when the mouth is closed, that the teeth meet and work properly. After I'm done with that, I'll often do an incisor reduction. I'll shorten the incisors so the pressure on the incisors, the molars, and the TMJ are equal. If you do a molar reduction and don't do an incisor reduction if it's needed, then what happens is the pressure is on the incisors and the TMJ because the molars aren't connecting early enough, therefore it's a lot of pressure on the TMJ. So it's really important once you do the molars to make sure that there's not space there, or gapping, where they're out of occlusion, where they're not actually touching. There's a little test I do. I move them left to right, and the incisors will separate once the molars connect. So if the movement left to right is too great and I'm not getting any connection, then I reduce the incisors, the mouth closes, and the molars come together closer. Now they're connecting when they're supposed to connecting, and that balances the whole mouth. So that's how it's basically done. There's another procedure